they've decided that they don't want to give him the chance to fight. And the longer that he waits, the chance of him fighting gets shorter.
It's been more than 2 months since Stephen Wong was diagnosed with gastric cancer, and he has yet to see a medical oncologist.
Do they know that he's 41? Do they know that he's a dad of 3 young kids? Do they know that he wants to fight?
But while they waited, things took a turn for the worse. Stephen's wife, Cece, says he was rushed to the ER with a number of complications as a result of his diagnosis. Even though he's been in the hospital for more than 40 days, his cancer is still untreated.
He was eating and coaching t-ball, coaching hockey still, May 2nd. And then from May 2nd till now, he's in a wheelchair and he's on a tube feed. So it happens insanely fast.
The president of the Alberta Medical Association says this is too long. Dr. Paul Park says a standard wait time should be a maximum of 4 weeks, but he's seeing cancer patients are commonly waiting upwards of 8 to 16 weeks to first see a specialist.
But when you get in to see our cancer specialist, you get some of the best care in the world. And one of the other pieces that's contributing to this is that patients, Albertans, are living a lot longer and with great quality of life once they start seeing these cancer specialists, because we can treat them, we can cure them, we can really prolong their quality of life. And that means that adds to the demand.
Park says this is a supply and demand issue. According to the AMA, the number of oncologists practicing in Alberta has only grown 20% over a decade. Meanwhile, the number of new cancer cases diagnosed each year in Alberta rose by 40% in the same period. The Minister of Health acknowledges there is work to do, while Alberta Health Services says they are working to address capacity pressures and improve access, including exploring options such as extending clinical hours to reduce wait times wherever possible.
I just can't grasp the fact that why a cancer patient wouldn't see an oncologist, whether or not they get treatment or not.
But for Cece, she's holding on to a lot of fear, still unsure when her husband will see an oncologist.
I fear every day waking up and him not being here. I fear every day him waking up and not getting treated.
In Edmonton, Laura Krause, City News.